Okay, Dr. Hoffman, BPD is so complex. Can you give us a working definition and what is at the core of the disease?
Well, to me, a working definition for borderline personality disorder is that it's a disorder of emotions and a difficulty in managing emotions. And I think this organizes itself largely around relationships. It's a disorder of relationships. So that's sort of the most concise way that I can put it.
And that is at the core of the disease.
Problems managing one's emotions. We believe there's a genetic component to it, and that there's something then that interfaces with the environment that makes somebody have problems managing their emotions.
Often I've heard from people that it's confusing. The term borderline is confusing. How did that come about, and can you tell us a little bit about how you feel about the term?
The term borderline, I actually don't mind the term borderline as much, because before I got the diagnosis, I didn't have anything to call it. So I was just so happy that it had a label. I'm okay with the term borderline. I've been fortunate enough to not experience a lot of the stigma and the pejorative use of the word borderline that I hear that many people like me go through. So I've been lucky in that part.
Do you have anything to say about the borderline aspect of it?
Well, the term originally was conceived because it was thought that people who had the disorder bordered on being neurotic and being psychotic, and that's where the term has come in. But unfortunately, it's so stigmatized because it's linked with a personality. So what does it mean to have a borderline personality? And I think that is at the core also of the stigma that surrounds the disorder.
It's been said that, as you just pointed out, that BPD is surrounded by surplus stigma. How does your National Education Alliance for BPD work to combat this?
Our mission is to raise public awareness and to educate people about the disorder. And so what we do is that we host conferences. We've had over 35 conferences funded by the National Institute of Mental Health, where we have the latest research presented on the disorder to educate, and unfortunately I have to say re-educate professionals that the disorder is not what people originally thought it was 20 and 30 years ago. We also have family members and consumers, like people that you heard today, on talking about the disorder, to put a face on the disorder. So we're fighting the stigma from several aspects. We also have a family program called Family Connections, where we are educating family members on the disorder and helping them manage the stigma that they interface with out in the community when people hear they have a relative with the disorder.
Angela, what was the evolution of your family and the people that are closest to you in dealing with your illness?
I think growing up, they always knew I was very sensitive. You know, the thing that I talked about today was this disorder or this illness doesn't pick between the haves and have-nots. And I believe I grew up in a very core family with middle-class upbringing, and it was for me the subtleties, the sensitivities I had growing up, whereas my brother, who had the same experience as I have, didn't go through those kinds of sensitivities. And so they knew growing up that I would be more moody and more sensitive. And it wasn't until I was about 15 years old then I started going through deep depressions, is what I would call it. My family is a medical family, and in fact, when they first found out that I had borderline personality disorder, they said, my mom's a nurse, my dad's a doctor. He said, borderline, but you're so nice. How can you have borderline? And so that was the stigma they were coming from being in a medical background, and also from being in an Asian American family where mental illness isn't really talked about. I think that was something hard for them to accept and be able to witness me going through the motions. It was hard for them.
How did Family Connections help you?
Unfortunately, I didn't do family connections.
I did. Okay, scratch that. What was the turning point then in your recovery?
Sure. I was deep in a crisis and in a hospital. The turning point was literally when I got my diagnosis, when my social worker said to me the 9 criteria, and I thought she was reading my autobiography because it just rang so true, and I've never heard of these things put together in such a way that made sense, and that to me was the turning point in my life.
Okay, Perry, can you tell us what Family Connections does for the families?
Family Connections is a 12-week course where family members come together. They learn about the latest research on the disorder, and they learn coping skills based on dialectical behavior therapy, or DBT. And what the family members also get from each other is another component that's incredibly valuable. And what our data show is that their levels of grief, burden, and depression go down, and their sense of empowerment go up. And actually that all these skills remain, so that all things continue to stay at a better level even 6 months after the program is completed.
Why are you doing this, Angela? What part do you feel you're serving?
Wow, that's a big question. Why am I doing this? Ever since I got my diagnosis, my life really turned around. And I wonder if I knew about this 15 years ago when I first started seeing symptoms, if that would have altered the course of my life. And I wonder about other people who struggle and feel so alone with it. I know the suffering is really unbearable. And that's why I think I'm doing it, is to let them know they're not alone, and to know that there's hope out there and there's treatment, that people do get better. But most of all, I think it's to tell our story. People, when they hear borderline, they kind of don't know what to think, or they may have misconceptions about it. And I believe the more stories we tell from people who have the disorder and experienced it and lived it and have gone through it, the better we're able to say, this is who we are. This is a community, and we're proud to be a part of this community.
You both are wearing the ladybugs. Could you tell us what the ladybug symbolizes?
Yeah, the ladybug is a symbol for our organization, which is the National Education Alliance for Borderline Personality Disorder, or more simply NEABPD. And the reason that we have this as our symbol is that the day the organization was formed, the 7 members who were in that room each saw a ladybug in different rooms by the end of the day, and we thought that's certainly a sign, and we need to remember it.
What is your takeaway message for families that are going through this?
My message to families is that there is hope. People do get better. This is not a lifelong illness. It's not a death sentence. And that if people get the right treatment, and if family members maybe are able to get the help and support that they need to be able to tolerate some of what this feels like to them, that life can change and people can go on and live a full, rich life.
And Angela, what is your takeaway?
So my takeaway message is to people who've struggled, and it's kind of what I've talked about in my talk today, was that no matter whatever was done to you or you have done, it doesn't define us completely. And there's always, another door of opportunity to open up, and we can take it, and we can live remarkable lives.
Amanda also started her own organization. Do you want to ask her about that?
Sure.
I started an organization called Rethink Bpd, and right now we're trying to do actually video-based storytelling for people who have lived and experienced BPD, and we're also doing a documentary as well. And I'm kind of in the role inside the documentary. Basically, I'm trying to bring awareness about BPD through boxing, and I'm trying to go and become an amateur boxer and be in the Golden Gloves to raise awareness for borderline personality disorder.
How did you pick boxing?
I wanted something empowering for myself. I started out and I did I had these crazy ideas. The first one I did as soon as I got my diagnosis, like 3 months later, I took a bicycle ride from San Francisco to LA in 7 days, and I loved it with great